Hello, everyone. Thank you for taking the time out of your day to join us. I am pleased to welcome you all to our Happy Wellness webinar, How Stress Affects Your Health, presented to you today by LuckyVitamin and Blocks of Health. I have the prestige honor of introducing you all to Dr. Lauren Beardsley. Dr. Lauren Beardsley is a licensed naturopathic physician, receiving her medical degree from the Southwest College of Naturopathic Medicine and Health Sciences. Prior to medical school, she worked with the University of Arizona in cardiovascular research and diabetic health, as well as with Scottsdale Healthcare completing research in family community medicine. She received postgraduate training in athletic performance optimization, pain management, women's health, and bioidentical hormone replacement therapy. Dr. Beardsley is currently an associate physician with Integrative Health in Scottsdale, Arizona, where she specializes in stress rehabilitation, mood disorders, hormonal optimization, and pain management. As a certified practitioner trained in the neuroendoimmune connection, Dr. Beardsley integrates her knowledge of how perceived stress directly affects the body's biochemistry and physiology. Dr. Beardsley also serves as the Chief Medical Director and founder of Blocks of Health, LLC, Wellness Medical Director with the Intercontinental Monte Lucia Joya Spa, and Chief Medical Director with Peace of Mind Healthcare Advocacy. She is an active member of the American Association of Naturopathic Physicians, the Arizona Naturopathic Medical Association, and the American Academy of Orthopedic Medicine. Dr. Beardsley resides in Scottsdale, Arizona, and when not practicing medicine, she enjoys hiking, walking with her husband and her black Labrador Logan, yoga, blogging, cooking, and traveling. I would like to remind all listeners that this webinar is being recorded, and we will email you a copy at the end. If you have any questions during today's webinar, please enter them into your questions box. At the end of the webinar, we will try to answer as many questions as possible. At this time, I would like to turn the presentation over to Dr. Beardsley, and again, thank you for joining us today.
Okay, good morning. Thank you all very much for the introduction, and I look forward to getting started today with how stress affects health, as well as some techniques that we can discuss and then start to implement to improve our response to stress. All right, so objectives for today, just to kind of map those out. So number one, I'd like to identify 3 main areas of life where stress does directly affect our health. Number 2, discuss some forms of what I like to call stress rehabilitation, which we'll get into in a few future slides. As well as number 3, develop some techniques, again, for being our best selves and creating resilience. So first and foremost, I'd like to start with a quote, one of actually my favorite quotes by Thomas Edison. And time is really the only capital that any human being has, and the only thing he can't afford to lose. Basically, you can spend $1 and earn $1 back, but you can spend your time and never get that back. So with that said, I'd really like to thank each and every one of you for investing your time today. I really appreciate and value your participation, and I commend you for looking into some ways to benefit your overall stress response. All right, so to start with stress. Stress, how this affects the body overall, and truly the reason behind why I selected this as a topic for today. It's a big piece of what I deal with clients on a daily basis. If you see listed here, 60 to 80% of primary care doctor visits are related to stress, yet only a measly 3% of these patients receive stress management help. So it's obviously a significant concern, and I believe it's underlying in the majority of conditions, of disorders, of dysfunction that I see. And because of that, I address it often. And kind of from a head to toe, just utilizing this visual here, stress can influence our overall brain chemistry can influence the production of neurochemicals, neurotransmitters, which will influence our ability to focus, have attention, mood disorders like anxiety, depressed mood. We can even influence panic disorders just in our ability to respond to our stressors, headaches, migraine headaches due to tension, grinding of teeth, muscle tension. Cardiovascular health-wise, it really influences heart rate first and foremost, which can translate into different types of rhythm disorders, arrhythmias, heart diseases, high blood pressure. From a digestive standpoint, it can influence digestive disorders, abdominal pain. It can really affect and exacerbate or worsen irritable bowel syndrome. It can lead to weight gain and obesity, a huge concern for 95% plus of my clientele. It can decrease sex drive, so it really directly influences our ability to produce hormones, in particular our sex hormones. And last but not least, it can influence your pain disorders, generalized pain, regional pain, fibromyalgia. So stress overall can be an underlying piece or cause to all of that. So the stress spectrum, I do like to discuss that not all stress is bad. We do need some stress in our lives to keep us motivated and keep us going. Stress isn't always a bad thing. In some cases, in fact, it protects us from danger. I mean, that's essentially the entire point of why stress exists evolutionarily. It's a leftover survival technique that we just don't have much use for now. We commonly in history fought for survival. That's that fight or flight response that was triggered by stress, which was imperative for our survival. But nowadays, we're not running from lions or bears or trying to avoid different types of predators as much as just trying to survive our workday or work-life balance or balancing all that. So the perception of stress is highly individualized. What can jangle our friend or colleague's nerves may really not faze you in the least, and vice versa. So in other words, what matters most is not necessarily the actual stress or what happens to you, but more so how you react or how you respond to this. So it's all about perception. So this is kind of a busy slide, this stress spectrum, but it's basically just describing here kind of an acute state of stress, and then that can translate into more chronic stress. So acutely and acute stress can happen within minutes to hours. You essentially have the stressor and then your perception and processing of that stressor. So, do you see this as a threat? Are you reacting in fear? Are you excited? Are you worried? However you perceive or process that, you'll be able to influence that with your coping mechanisms, your learning abilities, whether or not you're optimistic or pessimistic. This will all determine how you kind of balance and maintain equilibrium. Through that processing, that perception, you're going to have a response, a body, a physiologic response. That will be influenced by your overall physiology, your genetics, your environment, your nutrition, your sleep. So how healthy, how balanced your physiology is will influence how you're able to then translate down to the next step here, which is more of a psychophysiological state. So acutely here, speaking on an immune level, your immune system responds to an acute stress with increasing, with producing more white blood cells, with adapting, with turning on different humoral and different types of immune responses. In a balanced state, you have turnover, everything stays pretty homeostatic and balanced. Chronically, and a lot of the people I work with have more stressors that persist for days, weeks, months, into years. This is where you see adverse effects on the health. Overall immune dysregulation, this is where kind of autoimmune components can come into play, just your either over or under reaction of your immune system. So basically, just a progression here, it's your perception of, and then how well your body is prepared to handle that, and that will translate into your overall reaction. So the impact of being kind of stuck in that stress state, that fight or flight response long term, these are just some examples of, your more physiologic reaction, and then what that can mean to you from a symptom, from a disease standpoint. So, blood pressure rises, your stress hormones are influenced, digestive health can decline. Again, we had talked about sex hormones, growth hormones fall, your immune system weakens, your platelets can increase, and this translates into a lot of different diseases, disorders that are quite prevalent in the world today. So heart disease, mood disorders, and anxiety, sleep issues, weight gain in particular. This is a huge piece that I discuss very often with patients. GI, gastrointestinal disorders, and irritable bowel syndrome, premature aging, infections, autoimmune, and then heart attacks, of course. So, recharging your stress. What can we do? And I throw this on here because sometimes we feel like this is truly the only option. We're so overwhelmed, we're so frustrated, and not set up with the tools, so it feels like we just need to bang our head against the wall over and over and then repeat. I work with clients of all sorts of unique types of stressors, athletes that have significant physical demands, as well as mental, performance needs, business professionals, small business owners with living, breathing careers, needing that work-life balance, artists, musicians who travel a great deal, that can be a significant stressor as well, and then mothers, fathers, not only, caring for the family, all those responsibilities on a daily, hourly, minute basis, but also juggling the professional work-life career balance. So my point is that stress presents itself, again, in various unique ways, demanding boss, high-intensity exercise regimen, travel, all sorts of different things. It is not about what the actual stressor is. It's more our perception of and then our response to it. So before we get into, the three areas of stress that affect health and how we can kind of build that up, I like to provide a little bit of an incentive or motivation behind, why would we want to make all of these efforts. And truly it's about being your best self. I often have questions about how am I supposed to deal with stress if it's constant and I have a family, or, what can I personally do to just handle all of this on a day-to-day basis. So I try to imagine, what if your life was stress-free? What if you moved to a desert island and had no stresses and were on your own and completely stress-free? What would that look like? It's quite hard to imagine for most, but try. And what would you be like? Would you be energized? Would you be passionate? Would you be happy or helpful? Whatever terms you can consider. But that's something to think of and then kind of motivate you to work towards, because that's doable. It comes down to just building up your ability to respond in a choice on a day-to-day basis, to want to be your best self, and just kind of, when that stress button is hit, what can you do to shift your momentum from draining all your energy to maybe boosting yourself to being your best. So just a little incentive behind some of these tips that we'll get into in a few moments. So the three physiologic essentials that we will talk about today, the areas of health that are often compromised when we're in states of stress. And they seem so basic: eat healthy, sleep well, and breathe deeply. They're areas that we often don't focus on, that we assume are already taken care of, are automatic, that will happen without real significant effort. But if we are able to really focus in, kind of do-it-yourself technique, master these foundational pieces, which are crucial, then we'll be able to build our ability and improve our response to any of our perceived stressors. So, how I kind of came to this, and one psychologist that I really admire his work from a long time ago, Abraham Maslow, was a psychologist in the 40s who developed this hierarchy of needs. It's basically a theory of human motivation. So this parallels a lot of theories of human developmental psychology, some of which focus on describing just the stages of growth in humans. And Maslow studies exemplary people, not just basic people, but exemplary people such as Einstein, Eleanor Roosevelt. He also looked into, the healthiest college student population just to really attempt to identify what motivated them and what allowed them to highly achieve. So basically he found that people are motivated to achieve certain needs. And when basic needs are filled on the lower portion of this hierarchy here, then you're able to ascend up this hierarchy. Every person is capable and has a desire to move up. We just need to, start with the foundation. Oftentimes, unfortunately, progress can be disrupted because we have a failure to meet these levels. We can have loss of a job or a divorce or different types of stressors that can push us back down. But if we're able to really focus back on this foundation, on the basics, we can create that strong foundation and continue to move forward or move up. So that's where I kind of started with the sleep, the food, and the breath work to help us along the way. So let's start. Important to focus on getting healthy, nutrient-dense, good foods into our diet on a daily basis. We often use the metaphor where we're like, vehicles or cars, and you have to fill your car up with, decent gas to be able to function. So it's important to get that good fuel in the tank. Healthy food will support but when it comes to stress, a big discussion that I often have is how we eat and the management of blood sugar. So, blood sugar. With stress. Stress is going to stimulate, it's going to provide a stimulus to the brain. The brain is going to then translate down and trigger those adrenal glands, which are our stress responders, as well as our nervous system to really start pumping out different hormones. Adrenal health, adrenal gland-wise, we're going to start pumping out cortisol, which is our adrenal hormone or stress hormone, as well as some adrenaline, and we're pushing out that sympathetic fight or flight response. So that is what overall stress will influence, and we'll talk about how that affects blood sugar. So when your body's pumping out cortisol is designed, and in excess it's going to increase blood sugar. Increased blood sugar on this top left image here is going to then influence the production of insulin, and the cycle continues. So on this slide here, high elevated blood sugar, persistent blood sugar is going to long-term produce some insulin resistance, diabetes type 2. You're going to feel more wired and tired energy, so some instability. A lot of anxiousness, panic disorders often happen here. Weight gain in particular. Insulin itself is our storage hormone, so in excess that's going to lead to just the maintenance of translating or transferring over into fat production. So weight gain definitely happens, and then the metabolic weakening. Spikes down low blood sugar here is going to then affect our body to make more cortisol, increase that adrenaline, our energy crashes, we'll have a lot of craving, muscle tone, cellulite, or muscle tone will decrease, cellulite can form over, and again, the metabolic rate is influenced. So standard American diet, a typical American diet, is pretty erratic. How we eat, how consistently we eat is kind of across the board, and this is a pretty standard example. Waking up, breakfast around 7, your blood sugar spikes, and then you're going to have a crash midday. Mid-morning, pardon me. And then eat lunch, spike up again, crash once again. And you see when we have these crashes in low blood sugar, we'll have the weight gain, because you'll have the fat storage. You'll have what I like to refer to as the hangry state, tired, irritability, depressed mood, hungry, craving a lot. Our body does not like to have this erratic, imbalanced blood sugar. These shifts up and down lead to a lot of what we talk about here, the weight gain, etc. And in being able to balance this out, I've had people within days to weeks time notice improvement in energy, a significant piece, balance, mood, weight loss, and then long-term, prevention of heart disease, diabetes, all of those disorders that we talked about earlier. So this is a big piece with stress that I like to start with and just make sure that we're getting that foundation in place. Again, it's like a roller coaster, skipping meals, and then you're hungry, too much sugar, and you're just up and down, up and down. And how can you expect yourself to perform at all, if not, optimally throughout the day if you're going on this roller coaster all the time? So one thing that's important is the how we eat. Macronutrients, which I'm sure you're familiar with, carbohydrates, protein, and fat. They all give us different types of energy expenditure, but what I like to recommend is eating all of these macronutrients in a balance. So macronutrient eating or combining the 3 macronutrients together with every meal, every snack. So I thought this was a helpful slide to show just what different carbohydrates and proteins and fats are, and then some of the layover here. That of course some foods have a little bit of both, but when you are consuming all the macronutrients together, this will lead to a greater amount of successful chemical reactions in the body, a lower glycemic index, so you'll have more of a balanced blood sugar throughout your day. It'll actually slow how your food progresses through the GI tract. We actually call it a lengthening of your transit time. So it ensures that your body can actually break down and absorb your nutrients properly, so that you're actually able to utilize all that, and then it helps to maintain that balanced blood sugar that we were talking about. Second, breakfast. Breakfast, I believe this may be the first thing that I recommend with 80 to 90% of my patients. A lot of people aren't eating breakfast, and my example here was more for humor than actually eating Rice Krispie treats or whatnot in the morning. But breakfast, especially with some high protein, is a very important way to start your day. This actually can be the best way to set yourself up for the day. We're designed to thrive and eat breakfast every morning, and when we skip that, not only do we affect our blood sugar, we actually cause more insulin spikes throughout the day, and that can kind of throw us into more starvation mode, storage mode. So great ideas for breakfast. I often recommend like protein smoothies. Some people like to do, oatmeal, get some protein in there like nuts or some Greek yogurt. Hard-boiled eggs are great, whatever is palatable and doable for you in your diet. Breakfast every day upon rising within 30 minutes or so, that will really, really aid in your body's response to stress and being able to maintain that blood sugar. All right, so next we're talking about sleep. So what's tough with sleep is there's quite a vicious cycle. Stress causes a lack of sleep, but then a lack of sleep also contributes to more stress. So it seems like a very daunting task to achieve good, healthy sleep. But I have a couple recommendations that hopefully can give you some benefit. So this is a piece to basically show the intricacy of, again, stress and how it influences our physiology, but how it also can lead to some sleep deprivation, which then contributes to the compromised immune system, illness, etc. So we really want to pick this apart and find where we can interject and stop this whole process from happening. So stress up top and cortisol again. And cortisol is kind of a theme in all of this. We want to see how we can start to balance this cortisol rhythm so that you're able to have good energy throughout the day and then wind down and rest at night and have good quality hours, not just quantity. So here, cortisol and adrenal fatigue, a common condition that I discussed. This is a piece that I often look at for sleep management. So this is kind of your normal cortisol rhythm. Meant to be highest in the morning upon rising, kind of plateaus midday, plummets at night so they're able to fall asleep. And this is in reverse to melatonin here. Melatonin is just that beneficial hormone produced from your brain, your pituitary gland, to help. And it's a beneficial hormone overall for anti-carcinogenic properties, for providing anti-inflammatory properties, lots of different beneficial properties. But the focal point here is that cortisol, highest in the morning, and it plateaus down at night. This is the normal. Some different rhythms I've seen in my office. This is a salivary collection we often do, and they can be across the board, depending upon stress, how the stress is perceived, the duration of the duration of stress in someone's life. Up in this top left here, you know, a low level which spikes midday and comes down at night. This is more of a wired and tired picture that we referenced earlier. This picture is kind of low cortisol throughout the day, very depleted, most likely stressed for a long period of time, low energy throughout the day. This on the bottom example here is more elevated levels, most likely more of an acute stress, pumping out excess cortisol throughout the day, which can look more like anxiety, cravings, and a lot of sleep disruption. So this next example is more what I want to focus on for this piece. And the orange here is the client example. You'll see it starts low in the morning, kind of spikes up, back down, and then spikes at night. And I often see with insomnia, with sleep concerns, with restlessness, lack of quality sleep, that this is a pretty common theme. I mean, elevated cortisol levels in the evening. And that can, again, just lead to restlessness, mental chatter, difficulty falling asleep, staying asleep, all those types of symptoms that are very common in people's lives. So one means of approaching this that I found very effective and in helping kind of control cortisol rhythms, we had talked earlier about macronutrient cycling and utilizing all your macronutrients together. In my office and with many patients, I've actually done a lot of carbohydrate cycling. And just to get a basis of carbohydrates, there's simple carbs, which we'll call quote-unquote bad carbs. Those small molecules are digested very quickly, and they're not necessarily used, they're converted over into fat. These are more your processed foods, like your candies, your sodas, refined breads, all those types of things that are very available for the consumer. They're low in fiber, they're high in that glycemic index, and again, they convert more to fat. Complex carbs, however, are larger molecules. Their structures are large and they have quite a bit of fiber, so they're harder for us to digest. They actually take more energy, and it's released over a long period of time, this energy. So it takes more time to break it down. These good carbs are in their natural state: whole grain bread, vegetables. I often recommend legumes or quinoa. Sweet potatoes are a great form, or brown rice. This is high in fiber, low in glycemic index. Of course, it helps make you feel full without as many calories. But why I am discussing this is carbohydrate cycling with cortisol imbalance, with considering stress. The recommendation is lesser carbs for breakfast, a little bit more for lunch, and actually the most at night. So it seems counterintuitive, or what is actually not recommended for the mass public, but more carbs at night, these good, healthy, complex carbs, will help to keep that blood sugar balance throughout your night. So having some brown rice at dinner will prevent you from eating dinner, going to bed, falling asleep, and then having that blood sugar spike, or pardon me, the blood sugar drop. When your blood sugar drops while you're sleeping, your cortisol automatically turns on. And when that turns on, there's your restlessness, there's your mental chatter, there's your worry, your anxiousness, whatever is waking you. That we want to prevent. So by getting those complex carbohydrates in with dinner, you can really, really start to control your normal rhythms of cortisol and overall balance that out. All right, next, and this is quite a busy slide, our third and last area that stress can affect is our breath, and how we can kind of take back control of that. So this was more for the attendees to have. We don't need to go through all of it. There is a stress relief breathing technique that I've used very often with myself and clients, but breathing overall, boost energy. It can detoxify. It can relieve tension, strengthen your heart, assist in weight control. Lots of different positive things with that come with, mindful breathing. And how stress affects breath. So stress, that fight or flight reaction, that pumping out of our adrenaline, of our different hormones, will increase our breathing rate. It will increase tension, both mental, emotional tension, muscle tension. This will then affect immune health, how our hormones are released, our different brain chemistry, our ability to sleep properly, all those different things. So the stress increases the rate, which then translates into different health problems. And truly, this can be related to a multitude of health issues, from asthma, blood pressure issues, depression, migraines. It's not just, considering the lungs and respiratory concerns. It's pretty across the board. And when those health problems are established, they'll then make you feel more stressed, which will perpetuate this cycle. So if we can, again, somehow interject and determine how to prevent all this from cycling, we can start to make some changes. So with this slide, this is basically mapping out your your nervous system here, and then your breathing frequency or your rate, and then the depth of breath. So again, like we said before, when you're stressed, you are a strong sympathetic fight or flight reaction. You have a weak parasympathetic, that rest and digest is compromised, and there's an imbalance there. You're breathing very quickly and very shallow. And that's just the normal response when we're in a tune and we're not really aware of our response to the stressors. So that's the red. The green over here, this is what our goal should be. So this is weaken the sympathetic stimulation, strengthen that parasympathetic stimulation. This is where we have some balance. So the recommendation is to have very strong deep breath, so a high depth of breath, and then a very low rate. So very slow, deep breathing. Often for the yogis out there, we refer to it as belly breathing or diaphragmatic breathing. Just basically sitting still and kind of pressing your abdomen out while you take a deep breath in. That will force that diaphragm down, expand your lungs, allow you to just inhale that much more capacity, and it will actually stimulate the parasympathetic nervous system. This will calm that, the heart rate, all those types of processes down. These techniques can build both resiliency, if you're just working on them on a regular basis, or they can be really great to calm you down during a stressful situation. So a quick coherence technique, and I'm not sure if any of you are familiar with heart math. It's an institute out there that discusses a lot of how the heart is at the center of a lot of management of our body processes, and there's a really neat free smartphone app that I use very often with my patients. It's called GPS for the Soul. You can download it on your smartphone. It basically provides some guided imagery, breath work to help people through the above exercise, so the mentioned exercise here. But this exercise, super quick. You can repeat it, as many times as you like. But it's basically working to focus your attention in the area of your heart. So if you can imagine your breath flowing in your heart, in your chest area, and then just a little slower and deeper than usual, like we were talking before, that green box that we want to achieve. If you can just inhale 5 seconds, exhale 5 seconds, that's slower, that deeper. That will help to create more heart rate variability and more of a parasympathetic state. And step 2, if you want to go a little bit deeper, you can actually consider an experience or a regenerative feeling or an appreciation you had from some time before. A lot of times when I'm working on this, I think of my pet, my dog Logan, because she's just pure love, and I think of going on a walk with her or how happy I am to have her in my life. And it's just a real brief exercise, but that can help to just bring you back to center and increase that parasympathetic nervous system and bring that back to balance. This can also be incorporated, this breath work, into a meditative practice. In meditation, we often get really overwhelmed or intimidated by the thought of meditating. You know, our normal mind here is focused on all the external, the money, the family, the job, the food, friends, hobbies, etc. We're very externally focused. And then, you know, that type A, that I want to meditate, starts to concentrate. And we, you know, focus on the object of meditation, but we're very easily distracted because we're so focused and we want to do it so bad. Contemplative mind just kind of starts to consider the thought of meditation. Actually, a meditative mind is just purely focusing on the object of meditation. And the object can be a mantra that you're repeating over and over. It can be when if you're a painter, an artist, while you're painting, just really focusing on what you're creating. It can even be when you're doing the dishes, and I actually do this daily. You know, take a simple task that you're doing at home, take something that is part of your routine that maybe you don't care for, and just be present. You know, focus on whatever you're doing, and that's meditation. Use that breath work during that time, and you'll start to, you know, build up your resiliency and your ability to, you know, respond to your environment a bit better. So, kind of starting to close up a bit, but my goal today was just to have each one of you leave with some technique, some do-it-yourself, you know, home technique that you can really implement today to help you with your stress response, with your ability to respond to your day-to-day stressors, just make you that much more resilient. So is it eating regular meals, nutrient-dense meals to balance that blood sugar? Is it helping balance cortisol rhythms, you know, getting those 7.5 to 9 hours of quality sleep per night? Or maybe is it implementing a little bit of breathwork exercise, balance the nervous system out, and be able to, you know, respond to those perceived stressors a little bit better? And resilience is the goal. So resilience is actually defined by the U.S. Navy. I'm using their definition, is the capacity to prepare for, recover from, and adapt in the face of stress, challenge, or adversity. So it's just our capacity. We as humans are essentially energy systems, with the thought that energy is really not created or destroyed. We just have the ability to recharge our battery, to prevent it from being really drained throughout the day. But we really need to be proactive and not wait until stress has taken its toll. There's the thought of, you know, on an airplane with the oxygen mask, putting that oxygen mask on before helping others. And it really wouldn't do much good if the plane went down and you hadn't really prepped and put that oxygen mask on ahead of time. You need to be proactive with that example. Just be proactive and prepare yourself so that you have more capacity to respond. And with that increased capacity, the goal is just to be able to do more things that we love to do, be more capable of finding that work-life balance, and not be exhausted, not be so exhausted at the end of the day. And my last piece here is, again, a lot of times people do ask about families and stressors and being able to take care of just multiple responsibilities. A lot of people that have stress, have so much on their plate. So this quote, I have come to believe that caring for myself is not self-indulgent. Caring for myself is an act of survival. So ultimately, to achieve, we need to implement this self-care. It's very important. We let ourselves be taken care of, but we oftentimes don't take care of ourselves. We you know, focus on other responsibilities. So if we can consider the thought that we need to take care of ourselves so we'll be able to continue to take care of others, and, you know, ultimately be that best self that we were talking about earlier, that best self that you want to imagine and be for your family or your colleagues, your friends, your loved ones. Just want to be your best you. So to end, I hope some of these tools or these topics have given you some information, some techniques to recharge your health and build some resiliency. And I open it up for questions, and for any additional information or questions on some of the details of all this, do not hesitate to email me.
Great. Thanks, Dr. Beardsley. I know we cannot really prevent stress, but these topics and recommendations that you gave will surely help lower stress. We have a few questions for you, and I just want to remind everyone listening to, if you do have any questions, please enter them into the questions box. So the first question we have for you is, how does one control the stressors when it's a family member and an everyday occurrence?
When it's a family member and an everyday occurrence, well, I think that we just need to go back to the self-care. Often with stress, we focus on what the actual stressor is and how we can fix or remedy the situation, the person, the event or whatnot. But really, it's all about how, first of all, we're perceiving that and then how we're responding to it. So if you're able to just build up your resilience and be that much more capable of just responding to that, you should, on a daily basis, in particular, if it's a consistent thing, you'll be able to just respond to that much more efficiently and help out that person all the more better, if that makes sense.
Yeah, no, that's great. Thank you so much. Do you have any suggestions on how to actually fall asleep naturally? And how would you fix an erratic sleep schedule, maybe caused from stress?
Okay. And of course, again, I'm a naturopath physician, and the utilization of nutrients, of vitamins, of minerals, of different amino acids, it's a huge piece of what I do, and it's really variable and individualized per person. So there's lots of different herbs and vitamins and minerals that can be helpful with erratic sleep schedules. I have worked with a lot of people that work, night shifts and just have different day-to-day schedules, and it is a challenge. Your body likes routine. Your body likes to have kind of expectations and just feel taken care of. So when things are all over, it's really a challenge. So with that, whomever this is for, the erratic schedules, etc., if you can create some form of a routine, even if it isn't, be upon waking, upon going to bed. Sometimes I discuss sleep hygiene. Maybe winding down with a book or a bath at night, or creating some routine so that your body starts to know that it's time to go to bed, and then truly utilizing that carbohydrate cycling, getting a good, healthy, balanced dinner in prior to going to bed. It's a huge influence on hormone production and your ability to get that quality sleep at night.
Great. How would you recommend someone evaluate their stress levels? Is there any tests they should take, or do you have any just recommendations on how one can evaluate their overall stress levels?
There's various questionnaires. There's different things online that you can always access. For my patients, I do, of course, a basic history and physical, and just inquiring about past events, their ability to respond to things if they feel really overwhelmed in situations. And then from an objective standpoint, I have given you a few slides. I'm not sure if my screen is still up here, but in my office, we do a lot of circadian cortisol profiles, so salivary testing, and why this is superior to blood testing for cortisol. Blood test tells us if there's any disease state with cortisol, Addison's picture or different type, or Cushing's, pardon me. But most of the population actually has more dysfunction than disease. So dysfunction is identified with this salivary test because it's a 4, or there's even 5 or 6 or more collections throughout the day. What we really want to determine or detect is your rhythm. Are you high at night? Are you low in the morning? Where is that individual out of balance? And then that can dictate their therapeutic intervention. How would we approach that and balance those levels out? So salivary cortisol tests are really, really effective at just starting to give you a little direction as far as how to evaluate for stress and then how to balance it back out.
Thanks. One of the last questions we have for you, is there any correlation between psoriasis and stress?
Psoriasis and stress. Well, psoriasis, lots of skin conditions. Experts consider that an overreaction of the immune system. You know, psoriasis is that plaque formation, that excess skin in different areas over the body, and it's just your immune either be it hyperactive or hypoactive. So that whole autoimmune picture is very much so influenced by stress. I'm not necessarily saying stress is the main culprit or the only, but it can definitely influence psoriasis or skin conditions. That was a good question.
Thanks. The last question I have for you is, when is stress good? There's obviously some positive stress, and some people perform well under stress. So is stress ever good, and when does it become, like, what is the optimal stress level?
Yeah, so stress is definitely good, and in short bursts, it can be, you know, improve your performance. It can lead to more focus and excitement. You know, stress ultimately can be, you know, the excitement of your birthday party coming up, or that you're getting an award on the weekend and you're just, you know, getting kind of revved up and thinking about that. It's when stress, it's really hard to determine a specific, you know, time or interval when that would become a problem. It's more so when your body starts to, you know, have a detriment or starts to decline is when it's in excess. You know, when you're just overwhelmed by the amount of excitement, of activity, of demand. So one kind of example of this is when I work with patients with a lot of adrenal dysfunction that don't really have the ability to respond to stress very well, and they start to gain weight. And then they think, I got to work out more because I'm gaining weight and I'm freaking out. So they start to do boot camps and all these different exercise, you know, high intensity exercise regimens. That actually pushes them further into a worsening adrenal state and a worsening stress response. Reason 4, exercise is stress. You know, excitement is stress. Your boss, you know, asking you to come in on a weekend is stress. There's lots of different ways of experiencing that. So we have to be cautious on where we are as an individual, what we can handle, and then kind of divvy out things. And that's why really evaluating, like you had asked before, evaluating your stress levels and really knowing what you can handle if it's in question, that'll just give you all the more direction as far as what to implement, what's going to be beneficial, what can be detrimental for your health.
Awesome. Thank you so much. There's been a lot of great information, and I hope the listeners have enjoyed and even learned something today. I would like to take a moment to please ask all of the listeners to enroll in our upcoming webinars. Our next one will be Non-GMO, Your Right to Know, on Tuesday, October 13th at 2 p.m. Eastern, presented by New Chapter. You can join Shauna Wall, New Chapter's Manager of Education and Training, to learn more about GMOs in our food supply and to help take a stand. This webinar will focus on defining what genetically modified organisms are, how to avoid them, and how they might be found in foods and supplements you consume each day. To enroll, it's easy enough. Just go to LuckyVitamin.com and search webinar in the search bar. I would like to thank all of Lucky Vitamin's customers and Dr. Beardsley for joining us on today's webinar. Have a great day, everyone.